Hi, this is Chapter 5, Symptoms of COVID-19. So the Sheboygan County Public Health Department has provided a list of the most common symptoms seen with COVID-19. This list has been adjusted and tweaked all summer by the CDC and by Public Health as new data emerges. We've attempted to simplify it on our own list of COVID-19 symptoms. So, as you can tell, today something changed again. So we'll have to update it again. So basically, do not come to school if you have symptoms of COVID-19. Any of the following, if you have one of any of the following. A fever of a temperature of 100 or greater. For COVID, normally it's 100.4, but our own school policy is 100 degrees. So fever, 100 degrees or greater. A cough, which is new and unexplained. And then shortness of breath. And then the new addition is the loss of smell or taste as a new condition. So any one of those symptoms would be considered a symptom of COVID-19 and you would have to stay home or we would send you home. Or you have to have two of the following. So chills or shivering, sore throat, fatigue, which is unusual and unexplained muscle pain, new or not typical headache, and then GI upset or gastrointestinal upset such as diarrhea, vomiting, and nausea. So that's our list. It's on our district website. We need to update it again and get it back on the district website. Also, if you have symptoms of COVID-19, please stay home and contact your healthcare provider. And then do not come to school if you or anyone in your household are waiting for the results of a COVID-19 test. You or anyone in your household tested positive for COVID-19 within the previous 10 days, or you spent at least 15 minutes within 6 feet of someone COVID-19 positive the previous 14 days. So we've tried to simplify it on this list and we've tried to keep it updated and it shifts and changes. We will keep at that to make sure we have a current list. If your child develops symptoms of illness during the school day, we have an algorithm provided by the Department of Public Instruction, and then another one with some other guidelines on the back that are from the Sheboygan County Public Health Department. So if your child just needs basic first aid or just some time to rest to get over like a headache or something that's passing, they can come to the health room and rest, and we may just send them back to class after 15 minutes. We may just send them home if they just have some regular, normal, mild illness. That does not fall on our COVID-19 list. But if they do present with symptoms of COVID-19, they will be sent to what we're calling the COSI room, COSI, which stands for COVID Symptomatic Isolation Room. Here they will be examined. We'll be following this algorithm. This flow sheet provided by Sheboygan County Public Health Department. And then they will be sent home immediately if they have symptoms and that indicate they may have COVID-19. So just so you know, the COSI room is, in most cases in all of our buildings, it's a separate room or it's divided from the health room in some way to keep our health room, regular users of the health room separate from kids who may have COVID-19 symptoms. The standard time to stay home if you are sent home with COVID-19-like symptoms is 10 days of isolation. So that's unless a parent contacts their primary healthcare provider, who would then provide a note with an alternative diagnosis. So this is the reason why if your kids are sick, we really just need you to keep them home and give them that day or two to rest and recover, rather than send them to school and then to have one of these symptoms, which are fairly general, and then we have to send them home for 10 days. So that's why we're really encouraging you just to be safe and keep them home for the day. So I will discuss isolation and quarantine in, I think it's chapter 8. Thank you.